about the ankle sprain? Is it because he also, during the tournament, it was revealed that he suffered an ankle sprain? Do they go together in any sense?
In a way, they're very similar injuries. So I mean, they're similar in the mechanism. So if you break the bone, that's one thing, but if you're hurting the ligaments on the outside, that's another. But usually those injuries come from twisting your ankle. And so he probably, again, this is another instance where he may not have been 100% or he may not have been totally ready, and he may have just tweaked his ankle.
Why is that? Does the foot change? Does the manner with which the foot strikes the ground change? Is there some sort of, and I'm not, and again, I'm not a doctor, I only play one on TV here, but it would seem as if sometimes when you get one injury, it settles another part of the body. You try and sometimes make amends for another, and your body tries to do good when something else is having a problem.
I think you're absolutely right. There's always a part of that where your body's compensating for an injury, and other muscles and other structures in your body have to compensate for this. So they do their best to protect the part of the body that's not at its best. Neymar,
like Neuer, had surgery for the fracture, came back in time for the Cup. Total recovery time was about 4 months. On the other hand, Neuer's recovery took about 8 months. All right, I know we're dealing with different bodies here, but we're basically dealing with very well-tuned athletes and a certain part of the body. Why, in your opinion, would one take longer to recover than the other?
Well, for the first thing, Neuer had that re-injury at some point, so I think that's part of the reason why it took him longer to get better. Fracture of the second metatarsal tend to take a little bit longer than ones of the fifth. The fifth actually get better very, very quickly. I've seen people return to play at 8 weeks or 9 weeks, depending on the sport.